Hi there, this is Nursing Education Videos. Today I will be reading Hypokalemia NCLEX Review on Registerednursern.com. All credit for this information that I am reading goes to Sarah at Registerednursern.com. Please refer to the websites in the description box for all credit and information. Disclaimer from Registerednursern.com. This video is for educational purposes only and is not intended as medical advice. While we strive for 100% accuracy, errors may occur, and medications or protocols may change over time. Hypokalemia NCLEX Review Notes. Studying hypokalemia and want to know how to remember hypokalemia and how it is different from hyperkalemia? In this article, I want to give you some super easy ways on how to remember the causes of hypokalemia, signs and symptoms, and the nursing interventions for this condition. I want to highlight the material you will be tested on in lecture class or the NCLEX exam. After you read these notes, be sure to take the quiz on hypokalemia and hyperkalemia. Hypokalemia, you will learn the following: causes and easy mnemonics to remember it, signs and symptoms, strategies on how to easily remember, nursing intervention, things that NCLEX and lecture exams look for. Hypo equals low. Cal equals root word for potassium. Don't get it confused with Cal. Cal equals calcium. Cal for potassium is Kal. Emia equals blood. Meaning of hypokalemia is low potassium in the blood. Normal potassium level is 3.5 to 5.1. 2.5 or less is very dangerous. Most of the body's potassium is found in the intracellular part of the cell, inside of the cell, compared to the extracellular, which is outside of the cell, which is where sodium is mainly found. Therefore, potassium helps control the fluid inside the cell, while sodium helps control the fluids outside the cells. Therefore, if there is an imbalance of these electrolytes, fluid inside and outside the cell can become imbalanced. Blood tests measure potassium levels via the outside of the cell extracellular fluid. In addition, potassium is responsible for nerve impulse conduction and muscle contraction. The mnemonics are, for the causes of hypokalemia, ditch, D-I-T-C-H. The statement could be, your body is trying to ditch potassium. So D stands for drugs such as laxatives, diuretics, corticosteroids. I stands for inadequate consumption of potassium, which is NPO or anorexia. T is too much water intake, where it dilutes the potassium. C is Cushing's syndrome or Cushing's syndrome. During this condition, the adrenal glands produce excessive amounts of cortisol. If cortisol levels are high enough or excessive enough, they will start to affect the action of the sodium-potassium pump, which will have properties like aldosterone and causes the body to retain sodium or water, so retain sodium/water but waste potassium, hence hypokalemia. Heavy fluid loss, such as due to NG suction, vomiting, diarrhea, wound drainage, and sweating. So NG suction is nasogastric suction. Other causes, when the potassium moves from the extracellular to the intracellular with alkalosis or hyperinsulinism, there is too much insulin in the blood, and the patient will have symptoms of hypoglycemia. Signs and symptoms of hypokalemia. Try to remember everything is going to be slow and low. Don't forget potassium plays a role in muscle and nerve conduction, so muscle systems are going to be messed up and affect the heart, GI, renal, and the breathing muscles for the lungs. Weak pulses, such as irregular and thready, orthostatic hypotension, depression of the ST, flat or inverted T wave, and prominent U wave. Shallow respirations with diminished breath sounds due to weakness of accessory muscle movement to breathe, confusion, weakness, flaccid paralysis, decreased deep tendon reflexes, decreased bowel sounds. Easy way to remember 7 L's. Lethargy, which is confusion, low shallow respirations, which is due to decreased ability to use accessory muscles for breathing, lethal cardiac dysrhythmias, ST depression, shallow T wave, projecting U wave, lots of urine, frequent urination, kidneys unable to make the urine concentrated, leg cramps, limp muscles due to decreased deep tendon reflexes, and low BP, so low blood pressure and heart rate. It says here low BP and heart, so I'm assuming it's low heart rate. Nursing interventions for hypokalemia. Watch heart rhythm, place on cardiac monitor. Most are already on telemetry. Respiratory status, neuro, GI, urinary output, and renal status. Look for the BUN and creatinine levels. Watch other electrolytes like magnesium will also decrease. Hard to get potassium to increase if magnesium is low. Watch glucose, sodium, and calcium go hand in hand, play a role in cell transport. BUN stands for blood urea nitrogen, which is an indication of your kidney function. So higher than normal BUN levels may be a sign that your kidneys aren't working well. Administer oral supplements for potassium with doctor's order, usually for levels 2.5 to 3.5. Give potassium with food because it can cause GI upset. IV potassium for levels less than 2.5. Never ever give potassium via IV push or by IM, so via intravenous push or by So IM stands for intramuscular or subcutaneous routes. Give according to the bag instructions. Don't increase the rate. Has to be given slow. Patients given more than 10 to 20 milliequivalent per hour should be on cardiac monitor and monitored for EKG changes. IV potassium can cause phlebitis, so inflammation of the vein, or infiltrations. Don't give Lasix, Demandex, or thiazides because they waste more potassium, or digoxin because that can cause digoxin toxicity if potassium level low. Notify MD for further orders. Physician will switch patient to potassium-sparing diuretic spironolactone. The other name is aldactone, diazide, maxide, or triamterene. Instruct patient to eat potassium-rich foods. Remember potassium to help you remember the foods. P for potatoes, pork, O for oranges, T for tomatoes, A for avocados, S for strawberries, S for spinach, I for fish, U for mushrooms, M for muskmelons such as cantaloupes. Also included are carrots, raisins, and bananas. Don't forget to take the Hypokalemia quiz. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button and go to registerednursern.com for more information. I hope everyone has a good day.